Axia Women's Health is a community of OBGYN providers. We perform general OBGYN services as well as specialties of maternal fetal medicine, urogynecology, and infertility.
The provider recruitment team really guided me. I didn't really know what to expect at the time coming out of residency, so they kind of answered things before I could even ask or know what to ask. So overall, I had a really good experience with them.
I was looking to join a practice for my first job out of training where I could have others to ask for help, to bounce ideas off of, to help with OR cases. If something came up that was tricky, I wanted to be able to have someone else I could turn to, even if they weren't there physically, for help and guidance. And I felt like I knew I would have that here.
The work-life balance at Axia is important. They want to make sure that the physicians and the staff are all happy. Happy physicians, happy staff have better productivity, better outcomes. It's just a nicer place to work.
I knew work-life balance was a priority at my care center because many of my partners have been through this journey. So they are very family-oriented and they value time with their family. As a new mom myself, I wanted that shared experience. I wanted people who could understand what I'm going through. So it was really nice to see that reflected very early on. They made that a priority.
The culture at Axia, after working for 2 different Axia groups, is pretty much the same, which is nice to know that in 2 different areas really represents the company, that it's very welcoming, putting women first and patients first, but also being a nice environment to come to work to every day, enjoy the people that you work with.
At Axia, once you hit a certain number of years, you're eligible for promotion. We're involved enough in the goings-on of our own practice, our own care center, to know when we can promote somebody, and I think we're very upfront and honest about that. But certainly there is a pathway.
Axia's done a great job at really making sure that the senior physicians create a sense of mentorship for the associate physicians, and I never felt like I was flying by the seat of my pants or by myself. They really made sure that whenever I was in the office, I wasn't by myself at first, for instance, or if I wasn't on call by myself at first. After working for 2 different Axia groups, I have to say it's been the same experience at both.
So I know with my junior physicians, I'm always available for them to call me even when I'm not on call, as far as mentoring their thought process and asking questions so that they feel that they're in a safe, protected environment, and of course making sure that the patients are in a safe, healing environment.
When I get up in the morning, I'm excited to come to work. I know that I have a patient following, I know that I have support in my care center, and I know that I'm helping to make a difference and that my patients trust me.